Hello everybody, I'm Dr. Warid Altaf. I'm a consultant hand and upper limb surgeon at Sancheti Hospital, Pune. So today we are going to talk about wrist fractures. So being an upper limb and a hand and wrist surgeon, I think one of the commonest patients which we see in our clinic is a person who has suffered an injury to the wrist. The mechanism of injury is very common, be it a fall at home or sometimes a very high velocity injury from a road traffic accident, from a bike accident. So whenever we fall, our tendency is always to protect our head, chest and our body, and we stretch out our hands in order to avoid injury to our head. And that is the moment when there's loading on the wrist joint and the distal end of the radius bone, which is the bigger bone in the wrist, gets loaded in such a way that it gets fractured. And whenever there's an injury like this, we commonly see two sets of patients basically. One is an elderly patients who have osteoporosis. Those bones are already weak, and with a very trivial kind of a trauma, they tend to break their bones, especially the lower end of the radius, which we are talking about. And other is very high velocity injuries from a road traffic accident, which usually occurs in young individuals. So whenever there's such injury, I think the first thing is to get a primary treatment from any hospital and get the x-rays done, which are very important, because that is how we differentiate which of these fractures need a plaster or a conservative treatment, or which fractures are to be treated surgically. So there are various ways of treating them, but most of the times all of these fractures are treated conservatively with a plaster, with some minimal manipulation which can be done under some short anesthesia, and a cast is put for 1 month or 1.5 months. Some of the fractures which are very displaced may need surgical treatment, which is in the form of wires, K-wires or plate fixation. K-wires is a minimally invasive kind of a treatment in which we drill thin wires into the bone without actually doing any surgery. That means without cutting any soft tissues, without any stitches. So those bones are aligned and they are fixed with wires, and over that there's a plaster. So I think this is one of the most commonest ways of treating this fracture. And some of the fractures which are very grossly displaced, which cannot be stabilized with even these wires or plasters, they need an open surgery in which a small plates and screws are used, and the bones is fixed and they are immediately set to move the wrist from the next day. With both these treatments, patients usually require some physiotherapy for maybe a couple of weeks after the surgery, and the total healing time usually is around 1.5 to 2 months before they join back to all their regular activities. So that is all about the lower end radius fractures. Thank you.